Hi, I'm Ray Campbell, the Executive Director of the Massachusetts Health Data Consortium, and one of the issues that we've observed as a major, as a foundational issue that's going to have to be addressed in order for health IT to really realize all of the promise that we have for it is the issue of consent management. Having patient health information electronic has a lot of advantages, but one of the most important is that it then becomes easily shareable. When you're sharing information that's as sensitive as patient health information, you have to be sure that it's either necessary for an emergency treatment or that it's being done with the patient's consent. And that's when it starts to get a little more complicated and difficult. Turns out that people generally don't want to consent in an all or nothing fashion. In other words, yes, you can share my information, no, you can't. They usually want to put some qualifiers around that. Yes, you can share it for emergency purposes, but not for routine purposes. Or you can share it, you can share all of my information except for this information that I don't want shared. In order to capture and process those wishes, you need to have some sort of a method for consent management, for collecting the information about what patients' preferences are, for tracking it, for sharing it, and doing it in a way that doesn't require human intervention at every step of the way. That's the way it's done right now, and the problem is it makes it very expensive and difficult to share information. If we want to realize the promise of electronic health information exchange, then we're going to have to come up with systems for electronic consent management so that we can both honor patients' wishes but also share information as freely as necessary to improve the quality of healthcare and to lower costs.